In Colorado today from the Freedom Healthcare Staffing Company. We were able to get them ordered just under the wire. Again, we're hoping that we're a few days ahead of where other states are, not a lot. There's no new surge capacity available now for states who want it, but we got this in under the wire thanks to the emergency fund, disaster emergency fund. 50 new nurses arrived in Colorado today, are being deployed and getting their assignments to support our health needs. I also reiterate my call to registered nurses who are in other fields or have recently retired to contact your previous employer and offer your availability during a crisis if you need to come back to work, and that also applies to doctors, pharmacists, EMTs, and others. I want to thank everybody involved with this effort. We need to reduce the number of vulnerable people exposed to this virus. That's why we issued the strong guidance around limiting visitation in nursing homes. And we also need to engage in aggressive social distancing measures. Given the extreme risk to the high country, over the weekend we ordered the closure of downhill ski areas for a week, again, likely renewable, but we'll look at data. And we strongly advise that all visitors and residents of Eagle, Summit, Pitkin, and Gunnison counties, and those who have visited there in the last week or two, minimize social contact. That's really important. We have limited healthcare capacity in the high country, and we also want to avoid disbursement both within the high country and for those who have returned to the metropolitan areas. But we need to do more, and we're announcing some of those initial steps today. Yesterday, CDPHE announced that we're following CDC guidance on preventing crowds of 50 or more from gathering with the guidance on that. I would indicate that we assembled our GERC and met today, and they unanimously voted for us to adopt and to operationalize CDC guidance in real time. So we're going to be doing our best as a state when the CDC issues guidelines to adapt those rapidly and then operationalize those in the Colorado context. Thank you. But again, we need to do a lot more. We're looking at further steps we can take in this area, and we want to make sure that these policies work and prevent the spread here in Colorado. In that same vein, effective immediately, state of Colorado and I are ordering temporary suspension for 30 days, again, renewable, of dine-in services at restaurants and bars. Again, these establishments can remain open, but that's for takeout, delivery, and room service. I talked to a number of restaurants and the Restaurant Association earlier today, encouraging them with additional safety protocols around delivery, around making sure the sick workers don't attend work. And we're closing large places of gathering. That includes gyms and theaters and casinos where large groups can gather. These steps are very painful for our state. And while again, they may be an inconvenience to you if you're a customer, imagine how difficult they are for the workers and the owners of those facilities, many of whom will have a tough time remaining viable, the workers that will lose their jobs. We'll get to some of the work being done on the labor side, but these are very difficult decisions, the goal of which are to reduce the severity and duration of this public health crisis. Again, you don't want to be penny wise and pound foolish. If you try to squeeze a few more days or week of business into bars and clubs, you'd be looking at a much longer absolute closure and more drastic measures as a result of the lack of foresight that we hope we are showing by taking these actions today. We know that there's over 12,000 small restaurants, bars across the state. And I know firsthand they're some of the hardest business establishments to manage. I've been a success in business, but I've been a failure in the restaurant business. Unlike my predecessor, John Hickenlooper, who did well, I had two restaurants at different times that weren't able to make payroll. One was in business for several years before it went out. It's a tough business. It's tough for the owners, the managers. It's tough for the waiters, the wait staff, the bussers, and of course the entire supply chain. And there will be a time when we want to celebrate those local small businesses again. When it's safe, we want to go out, we want to go celebrate at bars and clubs, we want to dine out, we want to celebrate in places that we can congregate. But I think you all know who are watching this that day is not today, it's not tomorrow, it's not likely to be next week or the week after. Our hearts go out to the 240,000 employees in the food and beverage industry. Again, we want them to be creative, delivery, carry out other ways that they can continue to operate subject to CDC guidance and public health protocols. Colorado's Unemployment Insurance Division is also responding to many questions from both the employers and the employees. For employees who see a reduction in hours or layoffs, they can apply for unemployment benefits at coloradoui.gov, coloradoui.gov for those workers. Employers may also be eligible for programs to avoid layoffs, like the Work Share program. That allows employers to split the cost to retain employees with unemployment insurance. For instance, if a worker has to be cut from 40 hours to 20 hours, UI could pay 20 and the employer could pay 20. That's called the Work Share program. We are also anticipating additional federal action. Again, with a pending bill before Congress, but likely subsequent efforts as well with regard to the economic recovery as we address this public health crisis. Our state's jobs database, connectingcolorado.com, will continue to post listings for statewide jobs available. There will likely be paid work as well as the need for volunteers to address many of the immediate healthcare needs and needs of the economy and the public health. And I know that this is a difficult time, but we're in this together and we're going to get through this together. I'm also announcing that all DMV facilities and all Department of Revenue facilities will be closed to the public for 1 month, March 18th to April 18th. But behind the scenes, many of the operations and processes you can continue. You can renew online. State driver's license offices will be closed to the public. Again, continue to process the online driver's licenses. And for those that cannot complete renewals online, they can call the DMV call center during working hours at 303-205-5600. Customers who have appointments will need to reschedule those once a normal